The subjective experience for many people is a feeling of melding and blending with the universe, with those around them. It's a kind of nearly out of body experience that for many people is existentially profound. Because if they're in the right set and setting and frame of mind, what people describe under the influence of psilocybin is a kind of transcendence, a kind of like, oh, I got beyond myself and the narrow confines of my petty little self and petty little ego. And I was part of something much bigger than myself. I was part of the divine and the magic and the transcendence of this universe.
Yeah, it's like you realize how small you are, and the problems and the pain that is all consuming for you in the present. Like when you have that zoom out experience, you're like, whoa, this is just so ant like, you know what I mean? And maybe an inappropriate comparison would be the difference between you going through like suffering and then having like an acquaintance of yours going through suffering. Like whenever they're telling you the story, you can be moved to a certain extent, but if you don't really know them, if they're not really that close to you, you're kind of just like, oh, that's terrible, like I'm so sorry to hear that. Whereas if you were the one like telling the story, it would just mean everything to you, and it would be your whole world, and it would be all consuming. And it's that perspective shift I think can be really powerful.
So the first carefully controlled study that I'm aware of with psilocybin in the US took place, well, there were two, one at Johns Hopkins and one at UC San Francisco. And the only way that this was back in about a decade ago, and the only way the researchers could get approval, because remember, this is in the US a so-called Schedule 4 substance, which means it's regarded, a Schedule 1 substance. It's like DEF CON. One is the worst. Schedule 1, which means like, okay, this is on par with heroin. It's like super, super, super dangerous.
I think we call it a class A drug.
Okay, yeah, I like that better. Okay, so anyway, the only way the researchers could get permission from our Drug Enforcement Agency and the FDA and others to use this initially was they're like, okay, we're going to use it on terminal cancer patients who probably have less than a year or so to live. So they're dying. And we're only going to use it on terminal cancer patients who are being tormented by anxiety over their impending death.